If you have diabetes, you may be more likely than other people to develop heart disease, kidney disease, nerve damage, vision problems, and other health problems. If your doctor has diagnosed you with diabetes mellitus but has not checked your blood sugar levels after 3 months of treatment, he or she should do so at that time. You can also ask your doctor if it's okay to check your own blood sugar level. It may be helpful for both of you to have a record of these readings over time, particularly if they show patterns or trends, are overweight or obese. To determine if you are overweight or obese, calculate your body mass index. BMI is calculated by dividing your weight in kilograms by your height in meters squared. A BMI of 25 to 29.9 is considered overweight. If you are overweight or obese, you are at increased risk of developing type 2 diabetes and other diseases related to poor eating habits and physical inactivity. Have kidney disease. Diabetes can have a significant impact on your kidneys. Your kidneys are responsible for filtering your blood and removing waste products from the body. If you have diabetes, they need to work harder than normal to get rid of all this extra glucose in your blood. This can cause kidney damage over time, which eventually leads to kidney failure. Diabetes is one of the leading causes of kidney failure, but it's not always possible to tell if someone has diabetes because they may not yet have developed any symptoms. If you think that you might be at risk for developing diabetes due to having high blood pressure or an increased risk factor like being overweight or having a family history of type 2 diabetes, then ask your doctor about getting tested for it today. Have high blood pressure, especially if you're over age 45. If you're over age 45 or have diabetes already, it's important to watch your blood pressure. High blood pressure is a major risk factor for developing diabetes as well as heart disease and stroke. If you have high blood pressure, lifestyle changes can help control it. You may also need to take medications if lifestyle changes aren't enough. If you have high blood pressure, losing weight will lower your risk of developing diabetes. And staying at a healthy weight can reduce the need for medication to control your blood sugar levels. Have heart disease or a family history of heart disease or a family history of heart disease. If you have heart disease or a family history of heart disease, it's important to see your doctor for an evaluation. It is well known that diabetes can lead to serious health problems, including heart disease. In fact, diabetes is the leading cause of kidney failure and new cases of blindness among adults 20 to 74 years old. Diabetes increases your risk for coronary artery disease and causes damage to blood vessels in your heart muscle by increasing the amount of fat in your blood vessels that can build up over time. These damaged vessels become less flexible, which makes them more prone to rupture and blockages. An increased level of inflammation within your body also contributes to CAD by causing plaque buildup inside the arteries that supply oxygen-rich blood throughout our bodies. This buildup reduces blood flow through those arteries. If severe enough, it may lead to organ damage due to lack of oxygen supply, such as brain cells dying because they don't get enough oxygen. Fatigue is a common symptom of diabetes, but it can also be caused by other conditions. It's important to know that many things can lead to fatigue, including stress, too little sleep, and poor nutrition. So if you're feeling tired for no reason at all, avoid getting on the scale until you've ruled out these factors. However, if your fatigue has come on suddenly and there are other symptoms, such as blurred vision or frequent urination, then it's worth checking your blood sugar levels anyway. If they're high enough to be considered diabetes, more than 126 milligrams per deciliter, you'll have plenty of time to take care of yourself before the disease takes hold. Frequent urination and increased thirst. You may notice increased thirst and frequent urination. If you have diabetes, you might also experience blurred vision, fatigue, nausea, and vomiting. If you experience any of these symptoms or are concerned that they could be caused by diabetes, please see your doctor immediately to get tested. Slow healing cuts, bruises, and sores. You may also have diabetes if you tend to heal slowly from cuts, bruises, and sores. This is because low blood sugar levels can make you feel weak and dizzy. If you're feeling this way while recovering from an injury, it could be a sign of low blood sugar. Itchy skin, especially around the genitals. Itchy skin is one of the most common telltale signs of diabetes. Itchy skin, especially around the genitals, can be an early symptom that you have diabetes. Although itchy skin can be a sign of high blood sugar in people who don't have diabetes, It's also a symptom that could be caused by different factors, like dry skin or stress. Oh, it isn't always a surefire sign of diabetes. Vomiting, nausea, and stomach pain. Nausea, vomiting, and stomach pain are common symptoms of diabetes. They can also be caused by other conditions such as gastroparesis and pancreatitis. If you experience these symptoms, see your doctor to make sure there isn't another explanation for them. If your blood sugar is high and you have been diagnosed with diabetes, treatment will be necessary. There are many different types of medications that doctors will prescribe depending on how severe your condition is and how well they think it will respond to treatment options. Blurred vision is a common symptom of diabetes. The high levels of blood sugar can damage the tiny blood vessels in the eye, causing them to swell and leak fluid. This causes swelling in front of your retina, resulting in blurred vision. You may also experience this symptom if you have other health conditions such as high cholesterol or being overweight or obese, which increase your risk for diabetes and other health conditions associated with it. If you're experiencing blurry vision that seems to come on suddenly, even after eating normally, you should see your doctor as soon as possible because it could be a sign of something more serious like diabetic retinopathy. Diabetic retinopathy, DR, or macular edema, meh. If you have diabetes, you can manage your disease by keeping your blood sugar in a healthy range. There are many ways to do this, including controlling the amount of carbohydrates you eat and the amount of exercise you get. You might also need to take medications if diet and exercise alone aren't enough to keep your blood sugar under control. How can I lower my blood sugar? You may be able to lower high blood sugar levels by eating less food that contains simple sugars, such as table sugars, such as sweets and desserts, drinks such as soda, and foods made with white flour, breads. These kinds of foods cause more rapid changes in your blood glucose level than other types of food do. But eating too few calories from any source could make it difficult for you to maintain a healthy weight or build muscle mass. Your healthcare provider will discuss how much food with simple sugars is best for you based on what else is happening with your body, such as weight loss. When making these changes, diabetes affects more than 29 million people in the United States, according to the American Diabetes Association. But if you have diabetes and keep your blood sugar levels under control, you have a good chance of managing this disease successfully.